The aim of good leg ulcer management is to reduce the prevalence of leg ulcers through correct clinical assessment and management. This video aims to show how, by adopting a systematic approach to simple diagnostic work, it's possible to greatly improve the management of leg ulcers. At the heart of this approach is a thorough assessment, so that the most appropriate treatment can be adopted. We'll look at the use of the ankle pressure index using Dopplers. This technique determines the degree of arterial blood supply and provides an indication of the type of ulcer present. Leg ulcers are a common problem. It's widely acknowledged from studies in Europe that 1 to 2% of the population is affected. This figure increases to 4% in those over 75 years of age. This means that leg ulcers are a costly problem for health services. For example, in the UK, between £200 and £300 million is devoted to the treatment of leg ulcers. In Germany, between 400 and 500 million Deutschmarks, and in the USA, over $10 billion. At present, this is spent on largely ineffective management because the level of knowledge and the effectiveness of treatment is low. Ulcers can persist for many years because of inappropriate assessment and management. In many cases, the underlying etiology is not correctly assessed. The key to effective management is based on holistic assessment and treatment. The assessment of a patient must take into account all the available information. This includes medical history, the patient's lifestyle, and perception of the problem, as well as the general state of the patient and the characteristics of the ulcer. It's essential to determine the underlying pathology for the particular patient before commencing treatment. With any patient, a holistic assessment is essential to provide relevant information to influence diagnosis. Biographical, physical, and psychosocial factors should all be taken into consideration. The presence of a leg ulcer and the activities of daily living are closely interrelated. Examples include poor mobility, which leads to poor venous return, and poor nutrition, which can affect healing. Having obtained the patient's history, a detailed inspection of the limb takes place. The dimensions and appearance of the leg and ulcer are noted. An assessment grid can provide a useful structure promoting accurate and full records. Many leg ulcers occur due to poor tissue perfusion. This can be due to venous hypertension, arterial insufficiency, or a combination of both. If the leg is injured, the reduced circulation means there's not sufficient oxygen and nutrition reaching the tissues for healing of the wound to take place. 70% of all ulcers are venous. Other ulcer types include arterial, lymphatic, rheumatoid, and malignant. Visual appearance is not sufficient to diagnose. To understand what kind of ulcer is present, evidence of adequacy of blood supply to the leg is needed. Using a Doppler to determine the ankle pressure index, or API, allows rapid and reliable determination of the presence of underlying circulatory problems. Lie the patient flat and make sure they're well rested for 15 minutes. The blood pressure cuff must be placed around the limb on a level with the position of the patient's heart to minimize gravitational effects. Using the Doppler, first the brachial systolic pressure is determined in both arms. Note that a stethoscope should not be used. Making sure the patient is relaxed and comfortable, the sphig cuff is placed around the arm. Palpate the brachial artery and then apply gel. Using the Doppler, locate the artery and inflate the cuff until the sound disappears, and then slowly deflate. The point at which the sound returns is the brachial systolic pressure, which is then recorded. Repeat the procedure on the other arm and use the higher of the two readings in the calculation. If the readings are significantly different, this suggests arterial disease. Then the ankle systolic pressure is determined from both the dorsalis pedis and posterior tibial arteries. The sphig cuff is placed around the leg just above the ankle. Gel is applied, and then using the Doppler probe, locate the artery and optimize the signal.
All right.
Keeping the probe still, the cuff is inflated until the sound disappears, and then slowly deflated until the sound returns.
Right. We'll only do 3 seconds. Very good. All right, my dear.
This is the ankle systolic pressure and should be recorded. Repeat the procedure for the posterior tibial artery. The higher of the two readings is then used for the ankle pressure index calculation. Divide the higher of the two ankle pressure readings by the higher of the two brachial pressure readings. Alternatively, the API can be calculated using a guide to identify likely arterial insufficiency. In order to determine the API successfully, it's vital to use the appropriate equipment and to follow standard procedures which are technically correct. This simple technique forms part of the patient's clinical assessment. Looking at the process in more detail, the first consideration is patient position. Ideally, the patient should be lying with their head on a pillow. If this is not possible, then the patient should be semi-recumbent. Lift the legs to the level of the heart, or false readings may result. Make sure the patient is calm and rested for 15 minutes. Ensure that the appropriate sized sphig cuff is used. If a cuff of the wrong size is used, inaccuracies can occur. Where the wound gets in the way of the cuff, use cling film to cover it. If the patient has hourglass legs, use padding. If the patient cannot tolerate the cuff, then referral may be necessary. When assessing a leg ulcer, an 8 MHz probe is required for the majority of applications. However, if severe edema is present, a 5 MHz probe may be more suitable. Locate the dorsalis pedis artery with the Doppler probe and optimize the signal. The gel is a water-based coupling medium through which the ultrasound passes. Place the probe at approximately 45 degrees. Repeat for the posterior tibial artery and use the higher of the two readings for the calculation. The 3 following signals demonstrate what may be typically heard from the Doppler: artery, vein, and mixed. Having completed the examination, excess gel is wiped from the Doppler probe immediately after use, and the probe is cleaned with an alcohol-impregnated wipe to reduce the risk of cross-contamination. In this example, the ankle pressures for the right leg were 80 and 85, and the brachial pressures were 145 and 150. The ankle pressure index is calculated by taking the higher ankle pressure reading of the two pulses in one leg, that is 85, and dividing it by the higher brachial pressure reading, in this case 150. The API is therefore 0.57. Alternatively, an API chart such as this could also be used. To undertake an API, only systolic blood pressure is required. The Doppler cannot record diastolic pressure readings. If the API is greater than 1, then it's most likely that the underlying pathology is venous in origin. Beware of falsely high readings due to calcified arteries, which may be present in patients with a history of diabetes. If the reading is between 0.8 and 1, there's an indication of some degree of arterial disease. If it is less than 0.8, the dominant pathology is arterial and compression should be avoided. If the API is less than 0.5, urgent referral is required so that more detailed vascular studies can be undertaken. Always consider the patient's underlying medical condition in addition to API recordings. The clinical reading shows it may be safe to compress, but look at the patient's history and consider the etiology at all times.
just wear the belt and take the pain.
If a deep vein thrombosis is known or suspected, the API procedure should not be undertaken. Where the API is greater than 0.8, compression therapy should be used in the treatment of venous disease. Arterial ulcers should not be treated with compression. To treat the underlying pathology, sustained graduated compression is required. This can be in the form of bandages and stockings and will be used in conjunction with an appropriate wound care dressing. When choosing which bandage or dressing to use, consider consulting with the patient as to which would be the most appropriate product, taking into account the patient's mobility and lifestyle. Look also at how each product is designed to be used and how easy it is to use. Cost and availability will also help determine what options are available. Patient education is another important aspect to aid compliance. Whatever kind of treatment is used, a dressing to promote moist wound healing is required. Exercise should be encouraged where appropriate. Chiropody may be required if the feet are in poor repair, and well-fitting, sturdy footwear is essential to encourage mobility. Also consider the stage of the disease. Healing is not always an option. Treatment should then concentrate on the management of the presenting symptoms. Intermittent compression can be used in combination with compression bandaging and hosiery. It consists of an inflatable garment which can be placed onto the affected leg. A specially designed pump inflates and then deflates the garment with air. This reduces leg edema and helps heal venous ulcers. Intermittent compression generally uses a multi-chambered garment. In this video, a 3-chambered garment called Flow Plus is used. This is one of a range of products that are available. This device operates on a 3-minute fixed-time cycle. The pump inflates each of the 3 garment chambers simultaneously at graduated pressure to enhance fluid flow out of the leg. The wound is cleaned and dressed and the garment placed onto the leg. The pump allows for variable pressure settings according to what the patient is comfortable with. To improve patient compliance, initially pressures of 35 to 40 millimeters of mercury should be used. Treatment time and length of use will vary according to the patient's condition, and it's best judged by regular clinical assessment. Flow Plus can be used while the patient sleeps. Instructions for cleaning the garment can be found on the inside and should be followed carefully. With correct assessment, it can be used with caution in other clinical situations and may prove very beneficial, but this again is dependent on sound judgment from the facts available. The use of intermittent compression is contraindicated where there is severe ischemic vascular disease, edema due to congestive cardiac failure, known or suspected deep vein thrombosis, severe deformities of the limb, known or suspected fracture of the limb, any local conditions in which the garment might interfere. Effective leg ulcer management is dependent on a holistic approach to patient assessment and treatment. Consider all the factors relevant to that patient, then determine the API using the Doppler. Interpret all clinical findings cautiously to determine whether the ulcer is venous or arterial, and then select the appropriate treatment. This video is for guidance only. All treatment is dependent upon sound clinical judgment and a systematic approach. Specific training in the correct use of Doppler equipment is recommended.